sneezing your way through 2018, you are not alone. It seems like this year's allergy season has been extra brutal. Dr. Vijay Sharma, a sinus surgeon from Jupiter, joins us. So put this to bed for us. Has this season been worse?
So I would say yes. I would say yes.
Really?
So I've been practicing Florida for about 10 years. This is a tough year. What my experience is after hurricane season, when it's a bad hurricane season, allergies can be bad.
Well, allergies versus a cold. I know sometimes people get those mixed up.
Sure.
What's the difference?
So a cold is going to wash out in, let's say, 3 to 5 days, often a viral illness. Allergies can be more yearly sort of symptoms that last for weeks to months. Another important thing, I think, is chronic sinusitis to talk about, because the symptoms are similar to cold and allergy, but they can last for months at a time, regardless of the time of year. And there's some good treatments for that, too.
We're going to go back to that in just a second. In the meantime, allergy sufferers, what are some ways they can get relief?
So nowadays, a lot of the medications have come over the counter. So the things you've heard about, I won't necessarily say names, but the oral antihistamines and the nasal steroid sprays are all over the counter. You can walk in and spend $30 and you'll be good for at least a few weeks. And if that doesn't help you, then see your nose throat doctor.
Let's go back to that chronic sinusitis.
Yes,
it is different than allergies. How so,
yes,
though?
ma'am. So it is different in that it is an inflammatory condition which involves the sinuses, which are essentially hollow structures inside the head. The problem is that there's inflammation in the sinuses that can create infection and blockage. That's where really, I mean, that's the newsworthy piece. There's some real innovation here.
So that's the treatment option then?
The treatment options. I think we might even have a graphic. One of the nice things that's new and we use a lot in the office in Jupiter is called a Propel sinus implant. What it does is it holds open the sinuses and allows them to heal better after any sinus procedure and releases medication so that you don't need more sinus procedures in the future.
So that's definitely a doctor visit then?
Oh yeah. It's something we do we can do it in the office or we can do it in the operating room, which has become less common. Now we do more in the office.
When do you think we'll see a lull, kind of a break in the activity? I know you mentioned hurricane season, so. It
is a bit of a price of living in paradise that down here there's always something sort of blooming and there's dust and pollens and molds and mildews. So it's a cost of living in paradise.
Well, there you go. Keep your walking shoes on. I know you're busy treating patients. Dr. Vijay Sharma, thanks so much. We certainly appreciate it.
Thank
Steve,
you so much.
Maybe some of this rain will help a little bit?